Today on Talking Solutions, we're going to do a special show with the American Cancer Society. Gertie Schiller is with us, also Bernard Johnson. Both of you are involved with the American Cancer Society's Road to Recovery program.
Yes.
You're a volunteer, and Bernard, you are a patient.
Patient, yes.
Gertie, how did you find out about this, that they needed some help?
Well, actually, I was looking for something that I could volunteer in. I volunteered other organizations as well, but I just really wanted to help people more. And I found it in the paper. And so I called. I finally got the approval, and I started driving.
Gertie, I bet what they were doing actually was vetting you and making sure that you weren't a serial killer going and taking Bernard off on the road and never coming home with him.
Yes, they have to make sure that I'm a valid driver and have insurance, all that stuff. Yes.
But I'm sure they were very happy to hear that you were interested in helping out with the Road to Recovery program. So at that point, they have a driver, and I'm sure behind the scenes, the American Cancer Society is looking to put you together with a person who needs your services. Bernard, you are a cancer patient.
Yes.
What's your story?
Well, I was diagnosed with cancer October 2014. They set my radiation treatment up, and that's when I needed help to get me back and forth for my treatment. That's when they sent Gertie, and Gertie was with me until I finished, and I thank her so much for that. They need more drivers, people like Gertie.
That's what we're trying to put out there today, is to say that this is a great program, and that we need more people like Gertie to step up and say, hey, I think I could drive somebody to a cancer treatment. That's a wonderful thing.
I don't know what I would have done without her and the Cancer Society, but Gertie, I respect her a lot, and she did a lot for me.
Do you have any idea how many of these different radiation treatments that you needed to go through, Bernard, where Gertie stepped up and took you back and forth?
Well, I had to do 44 treatment, and Gertie came and picked me up majority of that 44. She came to pick me up and brought me back to the house.
We're talking about the American Cancer Society's Road to Recovery program. Gertie stepped up and said, I can help drive. Now, I think something like this, where Gertie, you're the volunteer, Bernard, you are the person getting the cancer treatments, and you end up riding back and forth in the car. I bet you find out a lot about each other's lives.
Yes, ma'am.
And in many cases, I'm sure a friendship forms, and you say, you know what, I know a lot about this person.
I love her dearly.
I'm rooting for this person.
Well, he was so much fun to drive because he's just so much fun to be around. And even when we got to the clinic itself, the doctor's offices, he just vibrated through the whole area. It was so much fun.
You make a friend out of it.
That's correct.
Yes.
That's correct.
Bernard, you went through 44 of these treatments for your cancer. What stage are you at this point?
Well, I was at stage 2 when they found my cancer. I'm in remission now. I go back and see my urologist. They'll let me know if I'm still in remission or not.
Bernard, without the services of Road to Recovery through the American Cancer Society, here you had 44 different treatments for your cancer laid out in front of you. What kind of obstacles were in your way getting there?
Well, expense like money. I didn't really have the money to get back and forth because I'm on a fixed income. That had a whole lot to do with it. And that's why I thank Gertie so much now today, because she made sure I was there. She made sure I was there back and forth to have my treatments. You know, I didn't have no problem at all because Gertie was there for me.
And it made a huge difference in your health as a result.
Big difference.
Wow, that's worth celebrating.
Yes.
If you had not had the services where Gertie is the volunteer, would you have been dealing with buses and hours of time and a lot of trouble to get there?
That too. I would have had problems.
Also in the studio, Emilia Carol, you are with the American Cancer Society.
Yes.
What is your position? I know that you haven't been with ACS for a long period of time, but already you're coming across these wonderful partnerships that have been put together with volunteers and cancer patients, and I bet you're involved already in all kinds of things.
Yes, my role is to manage the programs that ACS has for cancer patients and their families, and really to work directly with the volunteers and make sure the programs are running smoothly, that volunteers feel supported, and we're helping patients get the services that they need.
And this is just one of many different programs, I'm sure, that are offered through ACS, the American Cancer Society, that I'm thinking people aren't aware of. The idea of getting involved, like you've done, Gertie, as a volunteer for the Road to Recovery program, making sure these cancer patients are being transported back and forth safely to their appointments. I think a lot of people don't even know that that program exists.
That's right.
And you could always use more volunteers, I'm sure.
We can never have too many volunteers.
Volunteers are an important part of every charity, certainly with the American Cancer Society. And I know you're in charge of making sure a lot of these programs roll out and are taken care of. And Emilia, there are a ton of programs. Because even from my perspective, from the standpoint of our Talking Solutions show, I get people in here from ACS talking about volunteer opportunities that are out there. It's good for all of us to get involved. So, Bernard, at this point, you and Gertie aren't going on the road as much as you used to.
No, because she already took care of what she was supposed to do for me. Get me back and forth for my treatments. So now the only thing I do now is go back and forth to have my PSA checked out, to make sure he's at the right level, to make sure I'm still in remission.
We want you to stay in remission.
I hope so.
So just ongoing doctor visits just to make sure you're still on the right track.
Yes.
But as far as the treatments, at this point, we're done with that.
Yes, I'm done.
And it's all thanks to Gertie stepping up and volunteering
yes, ma'am.
in the Road to Recovery program.
Yes, ma'am. I thank Gertie. I love her so much. That's my friend.
And that's what happens. You are friends.
Yes.
Gertie, is this one of the best volunteer opportunities you've ever taken advantage of?
Oh, yes. And the thing about it is there's so many people like Bernard who don't have transportation and they don't have a lot of money. And so do they need us? Yes, definitely they need us.
Well, it makes you feel really special to make a difference in somebody's life.
Yes, it does.
And you make a friend.
Yes.
So have you gone on, Gertie, with the American Cancer Society and the Road to Recovery program? Is there another person down the road for you at some point in time? You're going to maybe help somebody else get 2 treatments?
Yes, I've done quite a few since Bernard and helped them through their treatments, taken them up. And once you find someone like Bernard, it's so easy to pick them up again and again and again. So you keep doing it.
And when you show up in your vehicle, they've got a smile on their face and it puts a smile on your face.
That's right, yes.
You said it right.
It's a wonderful thing to be involved in.
Thank you.
You said it right.
We think so.
Emilia, if somebody was interested in getting involved with the Road to Recovery program, how would they do that?
They can absolutely call our phone number, 800-227-2345. 800-227-2345.
American Cancer Society. Gertie Bernard, what a great story. Road to Recovery program. That is not that tough to get involved in.
No.
I got a car, clean driving record, I got insurance, I got time, I'm willing to help. And I'll let them have just a little bit of time on the ACS side for the Cancer Society to make sure that I'm a good driver, a decent person, and I'm up here and I'm willing to help.
Could I just add one more thing to that? Also, it's the fact that American Cancer lets you know exactly where that address is so you know how far you're driving. For example, I live Sunrise Mountain and I do not drive this end of the city. Like we're on Durango right now. I don't drive over here.
That's a ways.
Yeah, I'm not about to drive that far to pick up somebody and then take them to my side of the city, let's say. No.
But the American Cancer Society can pair you with someone who's closer to where you are.
Yes, definitely.
She still had to take me a long way for my radiation. That was a nice ride.
Well, yeah, but you lived our side of the city.
Right. I had 2 other volunteers that said, why you had to go all the way out this far for my radiation? I said, that's what my doctor referred me to. But Gertie, she picked me up every time I need to go.
And I bet you entertained her the whole way.
We
Yes,
talked.
we did.
We talked and laughed. And I was just happy just to see her every morning. I was happy because I know I'm going to have my radiation treatment.
Yeah.
Well, we're really glad that both of you came in to join us today because I think this is going to give other people who are willing to step up and volunteer, they're going to say, Road to Recovery with the American Cancer Society? I would love to do that.
I hope so.
I hope so, too.
Yeah.
They can help like I was helped like Gertie.
We appreciate both of you for coming in to share your story because I think it's going to motivate other people to get involved because you made a friend, you did some great things. And I didn't know about the Road to Recovery program until you came to visit today. So thank you so much for coming in to join us.
Thank you for having us.
Thank you.
Now on Talking Solutions, continuing our show with the American Cancer Society. Welcome, Tom McCoy, Nevada State Director of the ACS Cancer Action Network. Carol Roeder is in. You came all the way up from Phoenix to see us.
I did.
Carol is Communications
for the American Cancer Society, right.
Emilia Terry is with us as well. We're going to talk about a couple different things, but I know there's some things going on as far as colorectal cancer and awareness. I have a friend from high school. His father died at 50 of colon cancer. Back then, it seemed like 50 was old. Looking back at it, 50 isn't old. And I don't believe that all of these colorectal cancer deaths have to occur. Is a great deal of it awareness and screening?
Yep, absolutely. In fact, colorectal cancer right now is considered the second cancer killer among men and women combined. And it just doesn't have to be, because screening and testing can either prevent it or treat it at the earliest stage, and it is no longer an issue after that. Testing is definitely the answer to eliminating colon cancer.
Well, and no matter what kind of cancer we're talking about, early detection is key in every situation that I've ever heard of.
Early detection is important, but colon cancer is one of those that it truly can be eliminated or prevented at an early stage. But the problem is people are leery. They're kind of squeamish about the process, and that lessens the number of people who are screened. A recent study came out that said if every man and woman over the age of 50 were to be screened regularly by 2018, we could eliminate over 200,000 deaths related to colon cancer because they're screened. It seems like it's so simple. It just means getting screened.
Those are huge numbers.
Huge numbers.
That's not that far in the future.
No.
And you can make that kind of an impact. Don't you, at the end of this month, have a colorectal cancer roundtable?
It's something that we're doing, really a shared event for businesses, people in the medical community, hospitals, so forth. And we're bringing in some expert from American Cancer Society headquarters in Atlanta, and also featuring doctors from Las Vegas, Reno, around the state, who are coming together. And much like Carol was talking about doing something towards 2018, they're going to be saying, how can we get more people screened? That's the whole purpose of this roundtable. So the roundtable will have all kinds of discussions, and then at the end, we'll break out into groups saying, okay, now what do we do? How do we get to the goal of 80% by 2018? Nevada right now is 58, 59%. So you can see that between 2016 and 2018, we've got some work to do.
Yeah. How did you get involved with the American Cancer Society, Tom? It seems like everybody's got their own story. What made you come here and say, I can make a difference?
I think the fact that my mother had breast cancer not once, but twice. It came when I was young. I was in total denial, typical kid saying, oh, well, my mother, she can survive anything and everything. And I don't think I really felt as I became an adult that I shared what she went through. And I'm able to do that now with our volunteers, with people that I take for hearings. I go to Carson City and we pass legislation. Good example is that we passed a bill in 2013 that caps all oral chemotherapy at $100 prescription. That's it. That's the max. Prior to that, even with insurance, you might have been paying several $1,000s a month for co-insurance for those medical chemotherapies that you need. So that's the kind of thing we're able to do. And so in doing that, I meet with volunteers, I meet with people that are going through treatment, and it's rewarding. That's why we do it.
Wow. He's working on one right now with the Medicare loop. That is huge.
This gets into our discussion of where we are and where we want to be. And what we found out, the Affordable Care Act, as you know, is several thousands of pages, and the regulations are even more. And we found out that there was a loophole. So if you're on Medicare and you go to have a colonoscopy, which is one of the more typical approaches to screening, and they find something, not cancerous, precancerous, a polyp is what they're called, and they take it out. When you wake up, they say, good news, you don't have cancer. Bad news, you're going to pay a co-insurance for that procedure, even though you thought it was a free preventive screening.
And I was out through the whole procedure. Right. It's not like they woke me up and said, by the way.
Because they remove the polyp, which is the preventive eliminate cancer potential.
See, that's a therapeutic procedure. And so doctors and most people listening know that doctors do codes. Everything you do anymore with a doctor or a hospital has a code.
Right.
And they can't code that as a screening. They have to code it as a therapeutic procedure. And in Medicare, there is no coverage for that except to pay the 20% that the typical Medicare patient pays. Government pays 80, patient pays 20. And so what's happened is the word's gotten around, hey, you may have a co-insurance of $200, $300, $400, and people are saying, oh, well, I'm not going to do that. I'm going to stay away from that. And so we have an answer, and that is to try to get that law changed. And to that end, every congressman in Nevada has signed on. So that's Heck, Hardy, Amodei, and Titus. We just got Senator Heller to sign on. Senator Reid has not signed on yet for his part. And the reason I bring that up is our volunteers volunteers made that happen. I won't take credit for it. We had a volunteer who lost her husband to colon cancer. She and another one of our key volunteers went to D.C., hung out at Senator Heller's office, and got him to say, I'll sign on. And so he signed on to the bill.
Remarkable.
And that's what the Cancer Action Network's all about, using volunteers to do advocacy work for the American Cancer Society.
I'm impressed. Anytime you can get anything done through our reps in Washington, that's a big thing to start with. I won't be political. I don't need to be. But you identify a problem and then say, how do we set about fixing this?
And I should point out that we're talking about the barrier, and that's one of the things we'll discuss at the roundtable, to get rid of this barrier. But we have alternatives. We now have something called the FIT test. It's a commercial product, but it's called Cologuard. And these are tests that have been vetted. They're very effective. Patients can take the kit home and do it right in their own bathroom. They send it in, and if there is a positive reaction to that test, they go back to the doctor, and the doctor says, I think you better do the colonoscopy. But if they don't need to do that colonoscopy.
I've seen this commercial the last few weekends. It's relatively new. And I have shown it to my husband, who is resistant. I've done the screening, the whole colonoscopy. I've done it now twice, but I know that he's resistant. And it's the sort of test where I can say, look, it looks like such an easy test, because the whole colonoscopy thing is more involved. You actually take a day off of work, maybe 2 days off of work, to make sure everything goes just fine. It doesn't hurt. It just takes a little preparation, and that's the problem. It's just a little difficult to schedule. That's the only thing.
And these tests, the one that you're talking about that you've seen on television, that is covered by Medicare, because there's no question that there's going to be any therapeutic, because if they do find something in that test, then you have to go back in. So that screening is not going to cost you anything.
We have got Emilia, Tom, and Carol here in the studio. We're talking with the American Cancer Society, and our discussion at the moment is about colorectal cancer and screenings, and the fact that by 2018, you're looking to have 80% of people being screened. That number, as you mentioned, Tom, currently upper 50s?
Yeah, almost 60%.
So we still have some work to do, but the test that you mentioned, that is so much simpler, because they show on the TV commercial about Cologuard, where the little kid arrives at your door and you go in your bathroom, easy, send it off, and you get the results.
Interesting enough, Canada has just named the FIT test as their standard for colon testing. Canada. It's not colonoscopy. It's the FIT test.
And quite honestly, what we say is the best test is the test that gets done.
Yes.
Exactly.
And really, it means having a conversation with your doctor. Anyone over the age of 50 or anyone who has a family history of colon cancer should have that conversation with the doctor. Don't wait for the doctor to say to you, it's time. Take charge of your own health and initiate that conversation. Just talk about what test fits your lifestyle best. The best test is the test that gets done.
It sounds like this Cologuard test, or the FIT test, as you mentioned, this could be the thing that can get us all to that 80% screening number that we're looking for by 2018.
And more important, that's what's going to help us save lives.
And you were mentioning the number that just during that time frame, 200,000.
200,000 in Nevada, that's 3,000 lives. That's your neighbors, your colleagues, your family. 3,000 people in Nevada won't have to pay the ultimate price for colon cancer.
Colon cancer is such a deadly disease.
This year, 480 Nevadans will die from colon cancer.
And they don't have to.
And it doesn't sound like it's that difficult. And I had a person that I grew up around who lost their life to colon cancer at age 50. And you're saying that it doesn't have to happen.
Right.
Doesn't have to happen.
It's solvable. We can fix this. We just need screening and early detection.
And get that loophole fixed for Medicare.
You guys are working on that.
We're working on it.
That's the American Cancer Society's Cancer Action Network.
You got it.
I always ask, as part of Talking Solutions, what can we do as listeners to help you?
I think it goes back to having that conversation. Talk to your doctor. Give up the self-imposed, squeamish adversity to having at least the conversation. We're so shy about things like that, but have the conversation. Take charge. Know what's good for you. Know that a simple screening could save your life, and just press through. And whatever that test looks like, whatever that test is to suit your life and your lifestyle, and you're in agreement with your doctor, just do it.
And there's another thing, too. Doctors are very busy these days. We have people that are waiting months to see the doctor, and they don't usually have a lot of time. So you may have to be somewhat proactive and say, Doc, what about colon cancer? I understand there's tests now that I could use that I don't have to go do this prep thing and go through the colonoscopy and all this. And if the doctor says, well, I don't know about that, help educate the doctor.
You can do it.
You can do it, sure.
It sounds so simple. We're so squeamish.
Mm-hmm.
Oh, it's the bathroom. I love that. Little kids are read the book, Everybody Poops. It's part of life.
There's one thing that I would throw out here in terms of solutions for all of us that go beyond just colon cancer, and that is we all, each of us, can take control of our health by healthy eating and active living. And to that end, colon cancer responds to dietary issues. Too much alcohol is a factor. So there's some things that we can do, even if we're not even in that 50 to 74 range in which we say you should be tested. Let's take a look at how we're eating and what we're doing.
Great advice. That's why I got my nutrition degree, because those issues are so important. Emilia?
I just want to add that here in Las Vegas, Road to Recovery has already provided over 1,000 rides to patients in need this year, but we unfortunately have an unmet need of 800 rides that we couldn't find volunteers for. And it's estimated that this year, 14,000 Nevadans are going to be diagnosed with cancer. So we really need as many volunteers as we can get. And something very exciting that's recently happened is that we've partnered with Findlay Toyota. They approached us and they said, we have a shuttle, we have a driver, we want to spend one day a week and give rides to cancer patients in need. That really shows the commitment of Findlay Toyota to their community, and I'm really hoping that other car dealerships will come on board as well.
Because they all have shuttles and they drive around. They have people who are there to do nothing all day but drive.
Yes.
So that's what you're looking for, either individuals or companies, to get involved with the Road to Recovery program. And in case you missed out on it earlier in the show, that's where a volunteer steps up, gets vetted to make sure you are a responsible driver and that you have all the necessary insurance. But you step up and you say, I can drive a cancer patient to their treatment or treatments. And in a lot of cases, like Gertie and Bernard, who we spoke with earlier, it forms friendships. He had 44 treatments. She took him to most of them, and they're friends to this day. It's a great program, Road to Recovery. Also, the colorectal cancer roundtable that is coming up later this month. Participation by health personnel.
Healthcare professionals.
Yes, exactly. Doctors and healthcare personnel. The goal is 80 by 2018, which means 80% of people getting screened.
80% of all people over the age of 50 or those who have a family risk, but 80% of all people over the age of 50 are screened regularly by 2018.
Yes, Carol. And Tom, you were saying about this new FIT test, the one that we see on TV, Cologuard. You don't even have to go through the whole procedure in almost every case. And it's a very good, very effective test that is covered by insurance.
Yes.
There's really no reason why we shouldn't be doing this. So maybe through awareness, we can help get that number. Let's not even say maybe. Let's just say that through awareness, that number is going to be 80%.
And that's the purpose of the roundtable, to bring a focus to Las Vegas in late August at Roseman University. And from that, we will make some plans to bring this whole process to the public and get that 80%.
Professionals, volunteers, everybody can find something that they can get involved with as far as the American Cancer Society. The information on the roundtable, information on the effort to do 80% by 2018, the information about Road to Recovery, looking for volunteers to drive people to their treatments and such. All of that will be on the ACS websites, right?
Cancer.org is the American Cancer Society website, and everything is there. There's also a link to ACS CAN from there that will talk about legislative work and the influencing of legislators that the ACS CAN Cancer Action Network does. If anybody has any questions, our 800 number, 1-800-227-2345. That number is staffed by cancer specialists 24 hours a day, 7 days a week, 365 days a year, including Christmas. Available to answer any questions.
It's one of the wonderful things about the toll-free number with the American Cancer Society. I mean, that's been offered during previous discussions here on Talking Solutions for people who want to know more about detecting melanoma, people who have been diagnosed with cancer and just need somebody to talk to about it, someplace to get good information, all of that available.
Absolutely. Call anytime. The people who answer that 800 line do an amazing job of listening and finding out really what is the core need of your call. Do you just want to be heard? Are you looking for a service? Do you need a referral? They ask the questions so that they get to know who these people are and what their real need is so that they can provide answers and solutions.
And it's free.
And it's free.
And it's a great number to call when you want to volunteer and get involved.
Yes. Absolutely.
And if you're a patient and you need a ride to treatment, that's the number you can also call as well.
One size fits all. I want to say thank you to Tom McCoy, Emilia Terry, and Carol Roeder. Did I forget anything?
Not a thing. You've covered it all, but it's worth mentioning 1-800-227-2345.
1-800-227-2345. These numbers, the links, everything will be included also on our Talking Solutions Facebook page, along with a podcast of today's discussion. Thank you so much for coming in and joining
Thanks
us
for
today.
having me.
Thank you.